healthcare providers, we always talk about leaving everything in the office or the hospital and go home with a clean slate. But once in a while, there's that one patient that shows up and your life is never the same anymore. So was at the hospital, had this client, as every healthcare providers, the moment you walk in the room, you are always doing that scanning, head to toe scanning, and before the patient talks, you kind of sometimes have an idea of what may be going on health-wise, medical-wise, just by looking. Not all the time true, but most of the time you can guess. So I walked in the room. This gentleman is young, in the 40s, admitted was sent because he went to the office to see the cardiologist, the heart doctor, and was told his EKG was abnormal. So he was sent straight to the hospital. So I walked in the room, his family is there and friends, and he's sitting, no symptom at all. Chest pain, shortness of breath, if he got split pain, no diaphoretic, no nausea, no vomiting, nothing. So I started asking and did mention that every time he started walking, especially stairs or going out hiking, he will start having shortness of breath, and this has been going on for a while. So he decided to seek help. So he was sent to us. So he was scheduled to have a cardiac cath. So like any chest pain that is admitted, and when you go for cardiac cath, most of the time, they're probably going to go home the same day after the cardiac cath. If nothing is abnormal, you just discharge. So in my mind, I thought, he looks good, not obese. No, he had a history of high blood pressure. He's a vegetarian, born that way because of the culture. His family friend says he, at bedside talked about how he is always cheerful, talking, is a joker, and then he said, okay, probably not stress related. His lipid panel was a little bit off, mild, cholesterol was, I think, 206, nothing hateful, LDL, HDL, so forth. So I was like, I just waited and say, okay, this one after the cath, I'll just put a discharge on now, and they'll be going home. So kept looking, echo was negative. So cardiac done, guess what? Multivessel coronary artery disease, and cardiology was like, we need to consult the cardiothoracic because you may need open heart surgery. And I'm looking at this young man, like I say, he doesn't fit the picture of most of the people that get open heart surgery, because we are always looking at the risk factors. So my point here is that there are things that we take for granted, or think that we overlook, or we think, it's part of life. Stress is very dangerous to your well-being, not just mental health, but also the medical, the physical health. So that made me think twice about stress management. So you may be doing the right thing, eating the right thing, exercising, trying all the preventative measures, no diabetes, no high blood pressure, no high cholesterol, doing the right thing. But if you're not managing your stress accordingly, you are going to have issues. Yes. So we have to learn to let go of certain things that bothers us. We have to learn how to cope. Always ask yourself, can this situation change? Is there anything I can do? Or if it's something that is beyond your control, you have to let it go. You have to figure out, plan about it, process it, talk about it, and figure out how to let it go. Because the more we keep inside, the more it damages our body. So my friend, how are you managing your stress?